Every developed nation in the world has public health care, but a lot of people chose to pay for private health care. Why private health care is seen as a more and more attractive offer compared to public health care. Does private health care really provide better services than the national free public health care? Well, it's not necessarily true all the time, and maybe you should not pay for one if you are offered the free version. Just because all of the developed countries provide virtually free public health care for every citizen, that does not automatically make them a bad option to go to when you get ill. Just because you need to wait for an appointment for something does not make it a bad service. Just because you have to make an appointment to go and see a specialist for your unfortunate situation does not make it a bad service either, just because it takes a week for a scan on your aidsing leg. Again, that does not make it bad service. Most of the time, your condition is not that urgent anyway, and when you go to your family physician, they can identify if your condition is urgent or not. And if it is, then he or she can arrange an urgent appointment to scan your leg or whatever it is that you need a scanning of. And let's be real, 90% of the time, if you go to your family physician, you are there so that he can prescribe medication for the illness you are currently having. And most often, it's the same medication on repeat. Why? Well, it's because in most cases, that is how these doctors make most of their money. They make a nice percent of their money by selling you pills, and some doctors are grifters in this remark. And they will just prescribe you pills that you realistically didn't need that much, just so that they can make more money at the end of the month. Maybe this is justified somewhat by the fact that they have the longest career path compared to any other profession out there. To become a doctor, you need to go to a medical college that lasts at least 6 years, and after that, all you can be is just a simple family physician that has no other option but to sell you more pills to make more money. And if you give your best in memorizing all the different diseases there are out there by getting high grades, then you are eligible for the upper class of the medical industry, and that is your medical specialists like the pediatrician, psychiatrist, dentist, and so on and so forth for all of the other specialist roles that there are. Then when you enroll for a specialist, you add another 3 years at least on top so that you can earn the status of a specialist, which is when you start making the big bucks. And in order for a doctor to make those big bucks, someone has to be willing to pay them, and that is the second equation in this story. Most of the people who want to become a doctor enroll because of the high salaries that it provides, and not for the fact that they will quote unquote save lives. Paying for private health care means that you are paying premium rates for when and if you get ill or have an accident. So what is really the difference between private health care and public health care? Well, it's the luxury things like the comfort level where you may share a bathroom with other people instead of having your own bathroom, sharing a room with other patients instead of having your own room, no wait time for an appointment, better maintained facilities, better treatment, which means the doctor is mostly focusing on you and not on 10 others at the same time, and maybe access to a wider selection of drugs compared to the public health care, where the public health care is almost entirely free and you still get the treatment you need. It's just that now you are more equal to all the other people around you. The hospitals are not with the highest standards because they run on a budget and can't really afford to spend money on unnecessary things like the state the building is in. And let's be real, just want medication that is as cheap as possible, as well as a diagnosis of your disease that is also as cheap as possible, coupled with the fact that doctors expect and want those high-paying salaries. You end up cutting corners a lot. The solution to this might be to give more taxes for healthcare, like more developed countries do, like Germany or Canada, which have a bigger budget on public healthcare compared to smaller or poorer countries. But then people might get more greedy and the cycle begins again. There is no right path here, just people need to be ethical and moral about how much they are asking to be paid. So, when deciding whether to go for a private or stick with public health care, the answer I think might be clear. Go for public health care if you get ill a lot and don't want to waste a lot of money on medicine. And if you are afraid of those dark days that may or may not come, just get health insurance that you think best suits you for the yearly or monthly rate and stay worry free. And I'll leave you with this.
Did you know that psychiatrists are the only medical specialists that virtually never look at the organ they treat. Think about it. Cardiologists look, neurologists look, orthopedic doctors look, virtually every other medical specialties look.
Your total bill for this video will be a like and a subscribe, and also share the video if you want to leave a tip. And as always, stay mindful.